As Victoria's coronavirus wave sweeps across the state, there are serious fears for aged care residents. 24 nursing homes now have active coronavirus outbreaks, one of the state's biggest being Glendale Aged Care, with 12 cases and 1 death. 83-year-old Graham Smith lives at that facility and is locked down in his room. He joins us now along with his son Aaron, who's just outside but can't see his dad. Thank you both of you for joining us this morning, and we're so sorry that you're in this situation right now. Graham, you've had your COVID test. Any word on when you'll get the results?
No, I haven't. I had my second test on Monday afternoon, and I'm just waiting for the results.
How are you feeling about it, Graham? You've been in lockdown in your room for the past week. Can you give us an idea of what life is like for you and how anxious you're feeling about that COVID test?
Yeah, I'm a bit concerned. I got a report, an email last night to say there was another 3 cases had been detected in here. Yeah, it is a concern. But I feel the home, the aged care facility, the staff are doing everything they can to try and keep us safe. It's boring in isolation, but there's not much else we can do. It's for our own benefit. I'd like to get outside and get some fresh air, but make the most of what I've got.
Yeah. Well, look, I'm glad to hear that you're being well looked after. Aaron, it was your dad's neighbour, Alf, who sadly died at the weekend. How are you feeling about the situation your father's in right now?
Yeah, morning, Ali. So, obviously, quite afraid and quite scared what might happen. And as Dad said, received an email late last night confirming that 3 residents have COVID. So, I guess waking up this morning feeling more apprehensive and I guess more worried about what the future holds. But as Dad said also, they're doing all they can in the aged care facility at the moment to look after the residents and try to contain it.
One of the criticisms that we heard about Newmarch House in Sydney when they had that outbreak earlier in the year was the lack of communication. Graham, are you getting daily updates as to what's happening?
Yes, I get emails come through on a regular basis each day, generally in the evening, when we get kept up to date. My other son, Jason, he gets phone calls and notified if anything directly affects me. Aaron also gets the same emails that I receive in here.
Bill Shorten has said that he believes any person who has been infected with COVID-19 should be taken straight to hospital rather than remain at the aged care facility. Graham, do you agree that that should be happening?
Yes, I do. I think it would be a good move. It removes the infected person out of the facility, and the person suffering from the infection has got a better medical treatment available.
Yeah. You're an active man, Graham. I mean, do you have any idea how long you're going to remain in lockdown for?
No idea. It'll be, but whenever we're getting positive cases, I think we will remain in lockdown. I think we will need to have clear tests come back before they lift any of the restrictions on us.
Yeah. When news came through at the weekend that your neighbour had passed away, your reaction? Yeah,
a little scared. Yeah. It brings it very close to home. I live not far from where I am, and yeah, it was a bit of a shock. But I guess with the COVID-19 infection or virus, as bad as it is and as contagious as it is, it was bound to happen. Sooner or later, it would spread into a nursing home. But I think they've been taking steps here to screen the staff as they come on duty each shift. and I don't know that there is much more they can do to give a better protection. But I think moving us into a medical facility once a positive case is detected would be a good move.
Yeah. Look, it is an insidious virus and we all feel for you, Graham. And you too, Aaron. You can't get in to see your dad. We're thinking of you and we'll stay in touch. Thanks for joining us this morning.
Thank you. Thank you, Ali.
Carl. Says everything, doesn't it? I mean...
You know, Graham's sitting in there. He's lost a friend. This virus is in his aged care facility. You just heard him then. You saw his heart breaking. You saw his emotion. If we can't look after these people, then what are we doing? If one simple thing, and Bill Shorten has said it, Ali, let's move them out. Let's look at it, but let's try and give these people some comfort in the midst of this crisis. We've got to do more. Sorry. Well, on Melbourne's front line, already strained emergency departments are bracing for a wave of COVID patients as Victoria again records cases in the triple digits. Dr Emma West is Director of Emergency Medical Training at the Royal Melbourne Hospital, and she joins us now. Doctor, thank you for your time. This is never-ending, isn't it? And there must be such an emotional toll on your staff. We just saw someone inside an aged care facility there, and it's getting the better of so many people. How are you all holding up?
Good morning. Times are getting tougher. We're certainly seeing more patients with coronavirus, and these patients are very sick, and so we're well aware that this can take an emotional toll on our staff. And so we're really being vigilant, looking after each other and being kind to each other.
It's not an easy question for you to answer, but are you able to tell us how many more cases are coming into the hospital and the treatment moving into the more serious ICU stuff?
So over the weekend, it's been increasingly busy with patients presenting with either known to be positive with coronavirus or presenting, and we soon know that they have coronavirus, either because we recognise that clinically or later it pops up with a positive test. So we are getting busier, and so is the intensive care.
Also interesting and disturbing at the same time are the ages of people in ICU. I think you've got someone in their 30s, someone in their 40s, as well as the elderly. That's a huge cross-section, isn't it?
It is. I'm a little bit, we hadn't seen what they have seen overseas, and so I thought when we were going to start seeing lots of patients, I'd be seeing lots of elderly patients, but actually we are seeing younger patients, and that's a surprise, I guess. So we're seeing a full cross-section of ages presenting with, really sick with this virus.
Yeah, it's awful in the way that it's moving. Are you comfortable? Are all the workers there, the healthcare workers, comfortable? Are you satisfied with the amount of protection you have and being able to go to work and not get it yourselves?
We are fortunate that we had a good lead-in time to spend significant amounts of time training so that we're safe. We've got fantastic PPE, personal protective equipment, and we're really looking after each other, doing buddy checks, making sure we're doing everything we can to keep ourselves safe, because we need to turn up to work to look after the community.
Do you talk about it amongst yourselves? I mean, there must be fears. I mean, no one at any age wants to get this, and you're in the front line, so you're looking after people who have it. How is that? What is that like?
I guess we do talk about it, and you can't help but wonder what it would be like to be infected. But we just really spend all of our mental energy making sure we don't get it. So, even in the staff room, we've got meticulous practices to make sure that we're distanced, that our hands are clean, that we're wearing masks, and so we know we're backed by good training and good PPE practices. So it's the most we can do.
Well, I don't know where we'd be without you. Thank you for your time today. And amid this crisis, we've been getting a look inside the Royal Melbourne Hospital, albeit before the pandemic, and you can catch Emergency at 8:30 tonight right here on 9, Ali.